In this study, we looked at a total of 2,255 patients, and 1,071 of those patients had left atrial appendage occlusion with the amulet device. They were part of the amulet global registry. And this cohort of LAA occluded patients, we compared that cohort to a cohort of AF patients treated by a NOAC. And this cohort was sampled from a large group of incident AF patients taken from the Danish registries. I think it is very important to compare left atrial appendage occlusion with NOACs, because the only randomized data we have for this therapy, it is comparing left atrial appendage occlusion with warfarin. And since NOACs more or less now in most countries has become the standard of anticoagulation in AF, I think that is really what we need. We need data to compare left atrial appendage occlusion with NOACs. NOACs has now more or less replaced warfarin, and this is primarily due to the fact that this group of drugs have a lower risk of giving adverse events in terms of especially intracranial bleeding. Still, these drugs give rise to bleeding from other organs. They still come with a bleeding problem, and we in a broad AF population, we still see major bleeds with those drugs in up to 5% per year. So it is still a challenge. And this study, we looked at a primary composite endpoint of stroke, major bleeding, and mortality. And of course, first of all, it's very important that this therapy can give a good stroke protection. And in this study, we found the same degree of stroke protection for left atrial appendage occlusion as compared to NOACs. We had a rate of stroke about 2% per year in both cohorts, and that is a low stroke rate compared to what we should expect based on the whole risk profile for those patients. Because I want to stress that this is really a high-risk population of AF patients. They have a high risk both of bleeding and of stroke. But what was very interesting was that we saw a much lower rate of major bleeding. We saw an about 40% relative risk reduction for major bleeding, and also strikingly, we found a lower mortality with left atrial appendage occlusion compared with NOACs. So altogether, we found a primary composite endpoint very much in favor of left atrial appendage occlusion compared to NOACs. I think the findings are very important because a lot of AF patients are not today offered relevant stroke protection by NOACs due to their risk of bleeding, due to the problems with the drug compliance, due to the problems of really adhering to drugs for a long period of time. So patients that have a bleeding history or a predicted high bleeding risk, they have an alternative to NOAC, because they can be treated with left atrial appendage occlusion, and they can get the same stroke prevention benefit as with the NOAC drugs. This is not a randomized trial. It is still a propensity score match study. The level of evidence is better than in an observational study, but it's not the same level of evidence as in a randomized clinical trial. But fortunately, there are now several randomized clinical trials designed or even commenced where we compare left atrial appendage occlusion with NOACs. So I really hope in the forthcoming years that we can increase the evidence for this therapy even further, and it can be broadened out much more than it is now.